Hi, everybody. My name's Jen, and what I want to do today is introduce you to something called low pressure fitness. It can be referred to as hypopressives. But what it is we are actually going to be performing an apnea or a breath hold. And when we're doing that, we are lifting our diaphragm up and out. We're then lifting all of our intra-abdominal contents up, and then we are also lifting our pelvic floor up. We get activation of our pelvic floor musculature and our transverse abdominis when we do this exercise. So pelvic floor and transverse abdominis are parts of our inner core. They help stabilize our lumbar spine. Our pelvic floor helps support and lift all of our intra-abdominal contents, so all of our intestines, our rectum, bladder, uterus. And so these exercises can be helpful for postpartum recovery. They can help if you're having incontinence issues, whether that's fecal or urinary, so leaking bladder or stool or gas. They can also help with low back pain because they're working that inner core to help stabilize your core around your spine. They help reduce your waistline as a little perk, so make you look a little bit better in that bikini. And the other thing it will do is help increase your tidal volume. So how much air is being exchanged when you inhale or exhale, which could be helpful if you're a cardiovascular athlete, if you're a cyclist, runner, that kind of idea. So I just want to go over some of the basics and give you an idea of what it looks like. So first thing, maybe I'll show you what it looks like. What does this abdominal vacuum apnea look like? So what we're going to do for starting is you're always going to prep by 3 breaths. So it's going to be inhale, big thoracic expansion, breathing into the sides of your rib cage. Exhale all the air out. Inhale, exhale all the air out. And then on your 3rd breath, it will be inhale, exhale, 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 exhale. Stop, hold your breath. Lift your rib cage up and out. Lift your diaphragm up and out. We'll start by holding your breath for about 5 to 10 seconds. As you get more skilled with this technique, you can work your way up to a 30-second breath hold. So I just want to show you what this looks like. When we're doing this technique, we always want to think about having our 3 diaphragms stacked. And so what are our 3 diaphragms? You're like, Jen, I thought we only had 1, and it's right here. So this whole area is a pressure system, right? And so we can stop air from coming in our throat. We can close our glottis. We can help pull air in or out of our lungs through our diaphragm. And then our pelvic floor also helps with pressure regulation. So these are our 3 diaphragms, our glottis, our diaphragm, and our pelvic floor. So we want those 3 diaphragms stacked so that they can really talk and communicate with one another. So when I'm doing any of these exercises, I'm going to be in a really neutral posture. We don't want our neck really extended. We don't want our neck really flexed. We will use some cervical flexion and thoracic flexion during our exercise, but you always want to make sure that you have like a little bit of room underneath your chin, almost like you're holding like a plum underneath your chin. So you're actually creating, so instead of this, right, I'm actually creating length through the back of my neck. I don't know if you can see the difference there. So here, where I'm kind of closing, and then here, where I'm holding this space right there. And that is gonna help me get this apnea or this breath hold. Feet are going to be hip width apart when we're in a standing position. Knees are going to be a little bit flexed. My pelvis, I'm in a neutral pelvis, right? So I'm not arched, I'm not tucked, right? Neutral pelvis right here. Hip bones facing the wall. My rib cage is stacked over my pelvis. I'm not here. I'm not here. Okay, stacked, all stacked. So that's the first thing that we really want to practice when we're doing this. And then really working on that lateral rib expansion when we take an inhale. So we don't want, right, you can see that I'm using a lot of my ribs and my neck musculature to take that kind of breath in. We don't want that. I want you breathing right here. So starting it, it's a diaphragmatic breath. So starting from the diaphragm. So if you just sniff, that helps me find my diaphragm. And then I'm going to take my inhale starting from here. And let it out. You can put your hands on your rib cage. We'll do this as an exercise. One more like that. Inhale. And trying to keep our shoulders out of our ears, right? Okay, so let me show you how this looks. So I've got my feet hip width apart, softness in my knees, I'm stacked. All right, I'm just going to start with simple Venus arms. So arms out to the side, I'm reaching my arms out to the side, I'm active. Inhale, exhale, inhale, exhale. This next one, I'm going to go for it. Inhale. So what I do there, inhale, exhale, exhale, all my air out, stop, lift ribcage up and out. You don't want to take in any air when that happens. So sometimes when you're first learning, plugging your nose can be helpful. So plugging my nose and then lifting the rib cage, holding your breath for maybe it's 3 seconds, maybe it's 2 seconds, wherever you can. And then you want to think about stop your breath hold, let your ribs relax, and then let it go. Because what you don't want to do is just drop your ribs. So let me see if I can show you what that would look like. Right? I just don't want to drop them. So nice and slow. So stop, let my ribs down, take an inhale. Okay? All right. So I'm going to take you guys through a short workout. We'll do a warm-up and practice this in different postures. If you miss the breath hold, if you miss the apnea, totally fine. Practice your breathing, practice your diaphragmatic breath, practice your lateral rib expansion, okay? I would say also helpful if you can practice in a mirror. So when I was first learning this, practicing in a mirror was really helpful. Getting like my fingertips up and under my rib cage could be helpful. And I would say different postures work for different people. So for myself, learning it first in standing was challenging. I did better in what we call Artemis. So I'm in this position and I'm rounded. And I did a little bit better learning it in this position. There's some other positions we'll try. But give it time, give it practice, and you'll get it. And then we can just keep building from there. All right, cool.